Good evening, students. Welcome back to our channel Ach'z. So here in this section, we are going to discuss about the complete OET exam review and question paper discussion on 23rd November 2024. I saw some messages in correlation with that. So now about the first set of reading, part A, it was about cystic fibrosis. Paragraph A including the definition. Paragraph B, four main symptoms of cystic fibrosis. Paragraph C in the table format about the pathophysiology. Paragraph D about the management, including the antibiotic therapy and nutrient supplement. In that C1 and C2 about food allergy and technological innovation in medication. Asked more questions based on writer's attitude and opinion and also inference type of questions. Coming towards the second set, part A about cyclic vomiting syndrome. Paragraph A including description and phases. Paragraph B symptoms and causes. Paragraph C diagnostic evaluation including lab and imaging test. And paragraph D about medication like promethazine and erythromycin, etc. In that C1 and C2 extract, C1 about angina, C2 about lung cancer. So lexical references based and inference type of questions were more. Now coming towards the second module writing, in first set of letter to patient family GP, lot of information given today's date like 12th February 2024, patient name Mr. Frank Ethan. In the medical history, having hypertension, diabetics, and Alzheimer's disease, medication ongoing, metformin 1 gram and lisinopril 5 gram. Family history, parents' death because of cancer. So thereby the patient lived with the daughter. She is divorced and has 2 kids. The daughter got a job overseas and moved her father to home care setting. The patient can do self activities now and have good appetite. Given the history of the last 2 months of visiting, now patient have mood swings and depression, need to assess the changes because of the new living environment and have insomnia and imbalanced diet, not doing any type of exercises or activities. So our plan is to consult with speech therapist and also start short-term medication for insomnia, including all the information you need to write later to the family GP. Now about the second set, referral letter to community health nurse, unknown case, patient name Zara. Medication history, ectopic dermatitis, non-case of breast cancer and surgery done, chemotherapy is ongoing. Present complaint severe pain. We found it difficult to rule out a new vein and made it after 3 attempts. Inserted PIC, peripherally inserted central catheter. We need to write a letter including the care of the PIC line. Keep the dressing clean and dry. Check the site for swelling or redness or even pain. Avoid damaging the line. Seek for the medical advice if necessary. Coming towards the next module speaking. So coming towards the first role play card, setting is emergency department. Patient came to the department after fall. Patient is male, 52 years old, having the history of hypotension. So we need to check the vitals of the patient and need to ask the questions like how long were he on the floor, were he oriented after fall, were he able to mobilize following the fall by himself, had any urinary or fecal incontinence. And also we need to monitor the injury happened and explain about the care and follow-up. Coming towards the second role play card, settings community clinic, unknown case, mother and child. The child has constipation and mother is worried. So we need to reassure the mother and advise on increase the fluid intake, increase the fiber intake, daily exercise, establish a routine about the toilet habit, avoid constipating food. And we need to advise on the follow-up visit also. So that's about the second one. Coming towards one another, setting is hospital ward, patient for cataract surgery. So we need to advise on pre-operative care, advise on the fasting on night before surgery, take medication as advised by doctor, wash the face and wear the hospital dress and avoid jewels, bring sunglasses to wear after the surgery and reassure the patient about the procedure. So that's about the 3 different cards. Now coming towards the listening first set, talk with a neurologist and talk with a gastroenterologist. And the second set, talk with a cardiologist and talk with a rheumatologist. So that's about the available question papers we got. So thank you so much for your time. All the best for your results.